Hey there, Jem Gonzalo here, and welcome back sa Psyched Up, where we talk about mental health, psychology, at kung paano ito makakatulong sa sambayanang Pilipino. At sa video nga pong ito ay pag-uusapan natin kung saan ka nga ba makakahanap ng psychiatrist, psychologist, o ang mga mental health professionals na napag-usapan natin sa unang video. So if you haven't done so yet, please make sure to check that out. Disclaimer lang na ang mga institutions and resources na babanggitin ko are chosen based on my own research, experience, and knowledge as of the posting of this video. And so if you had a not so good experience with some of the institutions or resources that I will be mentioning in this video, feel free to comment down below to share your experience, but I'll just be leaving them up here for those who would also find them beneficial. But don't worry, I've also filtered out those resources that are strongly not recommended by other people so that we're left with those na naging okay din naman yung experience sa iba. Also, meron din kasi tayong tinatawag na client-therapist fit, kung saan nakadepende sa level of compatibility ng client at ng therapist ang satisfaction ng client sa service. These may be influenced by factors like personality, rapport, and other preferences. Kaya ang experience ng isa sa isang psychiatric or psychological institution or professional may not be the same with the experience of others. So we've organized the resources that I found based on the budget needed for them. So we start with those na free o libre. Then we go to those na with minimal fee. And then dun na talaga sa mga may bayad or private resources. I also included at the end of this video some emergency hotlines to contact in cases of emergency. So without further fuss, let's get on with the video. Kung gusto mo ng libre o with minimal fee na consultation with a psychiatrist, so take note, psychiatrist, not psychologist, ay ang unang-unang titingnan mo dyan ay ang mga public general hospitals. Ito yung mga ospital na pagmamay-ari ng gobyerno o ng publiko, kung saan nag-offer din sila ng maraming type or klase ng services, including psychiatry. So dito makakahanap ka ng psychiatrist na libre lang yung consultation. And usually, yung may bayad lang is yung gamot. Minsan pa nga is nililibre, depende pag may stock na galing sa DOH. Pero minsan din ay nire-require ka na magpa-lab test. Kasi minsan, yung mental health issue mo ay connected sa isang physical issue. But of course, it's cheaper sa public compared sa private. Now, hindi lahat ng general hospitals ay may psychiatry department. So, para sa ibang areas, it's still best for you to go to your local hospital and inquire from them kung saan yung pinakamalapit na public hospital na may psychiatry department or at least man lang visiting psychiatrist. And you can even ask a referral from them para masikaso kayo doon sa ospital na pupuntahan ninyo. Kung naghahanap naman kayo ng murang services from a psychiatrist or psychologist, yes, you heard that right. Sa institution na to, merong both psychologist and psychiatrist. Puntahan nyo or hanapin nyo ang nearest branch or chapter ng Philippine Mental Health Association sa inyong area. Ang PMHA ay isang private, non-stock, non-profit organization that provides premier mental health services through education, advocacy, intervention, and research. Ang HQ po nila ay located sa Quezon City, Manila, and meron silang 8 chapters in 8 key cities sa Pilipinas, including Baguio, Dagupan, Cebu, Cabanatuan, Cagayan de Oro, Davao, Dumaguete, and Lipa. I've listed the exact locations of these PMHA chapters along with their Facebook pages kung saan pwede kayong mag-inquire about their services, fees, and schedules. This list will be linked in the description down below. Some things you need to note pag nag-a-avail kayo ng services sa public general hospitals or even the institutions na mas mura ang fees, napakahaba po talaga ng pila. Siyempre kasi mura, di ba? Marami yung gustong mag-avail nito. So, usually talaga by appointment po yung mga institutions na ito. And usually it takes around 1 to 2 weeks, even a month, or even longer pag nagkataong madaming pasyente. Pero ganun talaga. Unless na lang kung yung case mo ay isang emergency case, diretso na si ER yan. Especially kapag suicidal or may self-harming tendencies na, diretso na po yan. Sa ang ER po, dun din po sa ER kung saan dinadala yung ibang cases. But well, kung ayaw mo naman ng mahabang pila at hassle at may budget ka naman, then we move on to the next option, which is private practitioners. And for this, I bring to you probably the most mentioned and most upvoted platform kung saan ka makakahanap ng private psychologist or psychiatrist, nowserving.ph. And you've probably heard about this before. So ang gagawin mo ay pupunta ka lang sa nowserving.ph and then dito sa search bar na to, tingnan mo, just choose any specialty right here kasi there's no psychiatry really dito sa kanilang front page. So, yeah. Yan. And then, in this filters button right here, dito mo na tatanggalin yung yan, specialty. And then, you'll just search for there's psychiatry. Okay. Meron ding psychology. Yan. Different types of services right here. Pag i-type mo lang yung word na psych, marami ng types of mental health services na mag-a-appear dyan. Okay. And so for now, we're going to choose psychiatry and psychology. And then, okay, pwede mo pang piliin. Okay, in the next one, HMO insurance provider, hospital affiliation, what type of service, okay, and availability, diba? Time preference, consultation type, kung physical or online. So, meron silang 2 options here. If you can't really visit the office, then you can go for online consultation. And then, of course, your location. I'll probably type Baguio City, right? Tapos, meron ding option right here to fee, yung range ng fee. Okay, to choose the range of fee. So, for example, yung budget mo ay siguro nasa 700, 750 hanggang, let's just try 1,500 for now. Wow, no, may pambayad. Anyway, so that's apply filter. And we have one doctor based in Baguio. Let's just check this out. Okay, so you can click on the doctor. And as you can see dito sa previous page, yan, you can see the name of the doctor. And then yung kung ano yung specialization niya. Yan, so for this doctor, he's an expert in general practice, addiction medicine. Tapos, pwede siyang online in-person consultation. Then the earliest available schedule is tomorrow 10 a.m. to 3 p.m. The fee is 1,300 pesos. At he is based at Roseville Rehabilitation Complex Corporation. Okay. So what you're going to do is you can just view his profile. There's an option to also book here. Yan, book consultation. And I'm a new patient. Tapos, yan, marami na yung mga iba pang infos na kailangan yung i-provide right here. Okay. Clinic visit. And then you will place right here the reason for booking or chief complaint. So, dito mo i-describe kung ano yung mga gusto mong ipakonsulta kay doctor. Now, I know that the Now Serving PH website is not exhaustive and only includes those na naka-register dun sa app. So, I found some other legit websites where you can find legit mental health services. So first up is the #MentalHealthPH Directory of mental health facilities, services, and organizations in the Philippines. So this directory was put together by #MentalHealthPH with the help of NCMH, or the National Center for Mental Health sa Pilipinas. And this includes the mental health facilities, services, and organizations in the Philippines. So what you're going to do is just to go to mentalhealthph.org/directory, and then you will see something like this. Okay, right? My search bar dyan, but then what you're going to be using is the filter entry right here below. Okay, so let's just remove the current filter. Okay, so as you can see here, meron ng 555 facilities all over the Philippines na included sa directory na to. So, let's try filtering entries, and of course, let's choose, okay, Cordillera Administrative Region. Okay, so ang ginawa ko lang, I did not really filter out anything else aside from the region. Pero, as you can see, you can also categorize or click some services right here, categories na gusto mong explore, classification, kung gusto mong government, non-profit ba yan, or private, semi-private. We also have some services offered. Yan, advocacy building. There's even emergency services, inpatient. Okay. We even have mode of delivery, whether you want face-to-face, hybrid, or online. And inclusivity tags. Okay. So for me, I just chose Cordillera Administrative Region. Let's try that again. Ayan. Okay. So, ang nagpakita, dalawa lang. Okay. We have the Baguio General Hospital and Medical Center. And we have another one, PsychStart, Psychological, Academic, and Arts Services. So, as you can see, makikita niyo dito kung ano ba yung category niya, kung hospital ba siya, government, and then also the type of services offered, including their location on Google Maps and their Facebook or social media accounts. Dito din, you can see that one there. So, the only problem that I have with this directory of Mental Health PH is that ang konti. So, for example, I filtered out Cordillera Administrative Region. Ang nagpakita lang is dalawa. But then, actually, we have a lot of facilities already here at Cordillera Administrative Region. Ngayon, so that's why I'll also take this opportunity to ask for your help because this is actually from a crowdsourcing. So, crowdsourcing, may mga tao lang din na naglagay dito ng mga institutions na to. Tapos, verify lang ng Mental Health PH, kaya siya nadagdag sa listahan. So, for us na may mga alam ng mga institutions or services na nag-offer ng mga mental health services, we can add to this list. So, what you're going to do is just to go back to that site. Alright, and then lalagay natin dito yung add listing dito sa may plus sign next to below the map. Okay. Add listing. Ayan, so yan, may mababasa kayo dyan na introduction dito sa crowdsourcing. And then, sa baba, pinakababa niya, nandyan na yung name of facility, category, services offered. Yan. So, fill up pa nyo yung mga yan. And this would also be a big help, syempre, sa mga kababayan natin na hindi pa nakakaalam nung alam nyo na psychological service or psychiatric facility. So, yan naman yung sa Mental Health PH. So for those na taga Northern Luzon like CAR, Region 1, 2, Calabarzon, etc., I found an additional resource for you. I found this on a Reddit thread which I was able to verify naman through the PPA website or the Philippine Psychiatric Association website, and registered naman po sa kanila yung mga psychiatrists na nakalagay dito. So psychiatrists lang po yung nandito sa listahan and not psychologists. So, as you can see in this thread, nakalagay dito yung government institutions with free psychiatric consultations in Northern Luzon. Makikita niyo naman, as we've mentioned earlier, we have BGHMC, Luis Hora, and then the Pangasinan Region 1 Medical Center, Ilocos Training and Regional Medical Center sa San Fernando, La Union, and we have private psychiatric consultations sa ibaba or with P. And as you can see in the table, we have the region. Dito yung region, yung pangalan ng psychiatrist, kung ano yung specialization nila, clinic address, time schedule, and of course, the contact number. So, I'm just not so sure kung ito pa rin yung mga updated na time schedules and contact numbers nila. Pero they are registered psychiatrists here in the Philippines. So, this was part kasi of a mental health kit given daw sa poster ng Reddit thread na to, given by the university a year ago. So, kung 2 years ago to, maybe around 2023, yeah, 2023 or 2022, nabigay sa kanila yung kit na to. For those na tiga-NCR naman, we have these sites. First up is the breakyourstigma.com, which is over here. Okay. So makikita niyo dito, may mga, nandyan yung mga directory din. We have for Metro Manila, Makati, Mandaluyong, Manila. And then you have the name of the hospital, the location, and then also some phone numbers that you can call. Another one is this mental health resource pack, which was compiled by Miss Sam. Credits to Miss Sam from Reddit. It's in a Google document. Okay. Existing naman po yung lahat ng institutions na nilagay dito ni Miss Sam, and she has a little disclaimer right here na most prices are from 2023. So it's still best for you to contact them through the contact numbers or contact details right here para i-verify kung ano yung updated prices nila. So yeah, we have PPPGH, free. Okay, tas meron din siyang notes kung mahaba ba yung pila doon. But again, disclaimer, she says that this is, most of the prices are from 2023. So yeah, it's in your own discretion how you'd be able to verify some of these things. Now, if you know of some institutions and other resources na hindi ko nabanggit dito sa video na ito, feel free to comment down below para makita din ng ibang tao some of the useful resources that they could find beneficial. So like I mentioned earlier, for emergency cases, especially pag suicidal na yan or have self-harming tendencies, diretso na po tayo sa ER. And there, they will be given some mental health first aid and will be advised on what further steps to take. Mas maganda din po sana kung may kasama tayo na pupunta sa ER. Now, in case na you cannot go to the ER, wala ka din kasamang pupunta sa ER, then we have these hotlines na pwede niyong tawagan in cases of emergency. First up, we have the In Touch hotline. So ito, widely recommended siya both in Reddit and Facebook. Very accommodating and responsive yung ating mga responders. So we have here their mobile numbers. Not sure lang kung anong networks yung mga yan. But from what I know, you need to have some sort of load para matawagan sila, but it's worth it. So this one for the first 3 mobile numbers. And then we have, I think this is a landline number. We also have their email address right here, and as well as their website. And we have another one, the Kalingang Bombero Hotline. So nandito po yung number nila. Okay. So nung una akala ko this is just like some sort of not legit website. It just sounds a little bit weird, pero this is actually launched by BFP. Kaya pala Kalingang Bombero kasi from the Bureau of Fire Protection. So we have 114 BFP personnel who are trained mental health professionals that are ready to provide assistance for those who need mental health support. So nag-undergo sila ng training from the National Center for Mental Health para matugunan yung pangangailangan sa mental health ng ating mga kababayan. And then lastly, this is not a hotline, but this is also an option that you can check out. I actually didn't know that this ever existed. It was only mentioned to me by a friend who attended a seminar from the DSWD. Ang tawag dito sa DSWD mental health support website is WiSupport, dswd.gov.ph. So if you're going to go to their site, it's going to look like this. So you're going to have to fill out a form, ganyan. And then from what I heard, they're just going to send you like some sort of email. Pag may naka-assign na DSWD personnel dun sa case mo, then they will be the one to contact you through your contact number that you've input or maybe via email. Don't worry kasi they're going to be asking you naman, is it okay to email you? Is it okay to leave a message for you at this number? So you can add yes or no. And then, of course, you're going to describe the concern right here. Tapos after that, you can send the request. Tapos keep your lines open kasi pwede ka nilang i-contact anytime. Depende siguro sa urgency din nung case mo. Just an update on this. So nag-reach out na sila sa akin less than 24 hours after I submitted the form on their website. As you can see, I was endorsed to FO CAR since I'm currently based in Cordillera. Aside from email, may text message pa sila, and they also called me kasi I chose the option na pwede silang tumawag. And that's a wrap. Thanks for watching this video. And if you found this content helpful, don't forget to hit like, comment down below, share, subscribe, turn on the notification bell para lagi kang updated sa ina-upload kong videos. So, see you in the next vid!